Muhammad, assalamu alaikum.
Walaikum salam, Dr.
How are you? I was just reviewing your blood tests, and your cholesterol is pretty high for a young man. It's about 4.7.
Really?
Yeah, does it run in your family?
Yeah, my mom has it, but we always, and what I've known, that we don't take the medication and we just use apple cider vinegar, turmeric, cinnamon, and a mixture of that is usually doing the job for my mom. So I think I could just start doing that and I should be fine. No?
Actually, that's not exactly right, because if you're very young and you have very high cholesterol and it runs in your family, that's called familial hypercholesterolemia.
Okay.
That means it's inherited, which means you've had it since you were very young. That means it puts you at risk of having heart disease very early, because it starts from when you were born, not from when you are older.
Okay. But so far, my mom's taken this home remedies and she's doing fine.
So we can't be sure that she's fine unless she does testing, right? So the first thing that happens is cholesterol has no symptoms until a person, God forbid, has a heart attack or a stroke. It's a silent disease, but it's very serious, especially if it runs in your family. So there's also been an interesting study called the SPORT study, where they actually looked at a small dose of a cholesterol-lowering medication, 5 milligrams, compared to turmeric, garlic, red yeast, rice, and a number of other remedies. Do you know what they found?
Tell me. No idea.
So with the 5 milligrams of this cholesterol-lowering medication, the cholesterol came down 39%. With all of the others, the cholesterol went up, didn't go down.
Oh, wow.
Including apple cider vinegar. So there is actually no truth to any of these stories. They're not real. And in fact, they may be harming people because it goes around on the internet, and I've heard it from a lot of people. And that's actually dangerous, especially in young people who have very high cholesterol.
Dr. Hani, how's it going?
I'm good. So we started the medication I gave you last time, right?
Actually, not yet.
Oh.
I got the prescription, I went to the pharmacy, got the medication, but the moment I got home and I saw the medication, I read online and I talked to some people that told me there's so many side effects. Muscle pain, could lead to dementia and losing your memory, and so many other negative side effects that I thought I should just hold off till I come back and see you and figure out whether it is really true. Will they have these side effects on me or not? And whether I should start them. So I would like to have a bit more information before I get started.
Sure. So thank you for that feedback. Of course, there's a lot of stuff on the internet that is unfortunately not validated. So did you find it on Google, YouTube, or one of the medical websites?
To be honest, it was all patient feedback. So I don't think it was any medical journals. It was just general reviews on the internet from patients that have taken the medication. But you know what? Now that you've mentioned it, I don't think there was anything official.
Right. So the problem is there's a lot of unvalidated information on the internet. So clearly there are some side effects of cholesterol-lowering medication, particularly the statins, but it's rare. So about 3% of patients will have some muscle side effects, but you switch from one medication to the other and you overcome that. And usually it's associated with some low vitamin D, not really the real problem. So when you look at all of the stuff that's been looked at for decades now about cholesterol-lowering medication, it does not increase the likelihood of dementia. In fact, it reduces the risk of stroke. It does not increase the risk of cataracts or bleeding in the brain or gallbladder disease. If anything, it's the exact opposite. So the safety of this has been shown for almost 800 million people over the last 40 years from multiple different medications. And in fact, the benefit is so tremendous that in people who have high cholesterol, it's almost a crime not to lower it aggressively, especially in young people like yourself.
Hello, good morning, good afternoon, good evening, everyone. My name again is Reem Eladl. I'm the Director Patient Engagement Country Partner for China and Japan. And I'm so happy and honored to be with you today for the third consecutive year for APPIS. Let me start first by thanking Professor Hani Sabbour and his patient engineer Mohammed Yunus for the very insightful role play video they introduced that tackles a couple of widespread misconceptions that are widespread among our patient community. And now, for the sake of time, let's kickstart our CARE Unblocked Fireside Chat by welcoming our constellation of guests, starting by Professor Mahira Said, our Professor of Dermatology and Venereology from Egypt, Professor Hani Sabbour from Abu Dhabi, our consultant of cardiology and pulmonary hypertension, and last but not least, Mrs. Nermine Zakaria, who represents our patient community, and she's a founder member of the Psoriasis Patient Organization under development in Egypt. So welcome all to our fireside chat discussion. And before we start, let me first remind our audience and encourage them to post their questions to our panelists on the chat board. And we promise that by the end of our discussions, we'll get back to you with some few selected questions because of the time constraint. So now, starting first by Professor Mahira Said, having already viewed the video and being a dermatologist and a psoriasis specialist, have you witnessed any of those cases in your clinic, and how did you manage them?
First of all, I am honored, and I want to thank you for your invitation to be part of APPIS, because I think this is extremely important. Welcome, Dr. Hani. Welcome, Nermine. Thank you for being with us. I love the video because it's so typical of the patients, and we have to do something about it because there is definitely an area of miscommunication between the physician and the patient. You are talking to the patient and trying to convince him with one side of the story, and he goes home and listens to everybody else but the healthcare professional. So I think we have, first of all, we have to listen more. Second, we have to learn from the patient. Dr. Hani's patient gave an extremely excellent example when he came back after he prescribed the medication, telling him that I've read about the side effects. So I think that as professionals and as healthcare providers, we should spend more time with our patients explaining the aspect of the disease, like Dr. Hani did, how serious their disease is and how important is treatment. And again, we have to try our best to filter the information they're getting. I know it's not easy. And by the way, I am attending now, I'm in New Orleans right now, attending the American Academy of Dermatology. And we had an interesting discussion yesterday about open access journals. And having open access journals is giving access also to lay people. And they think that this is extremely dangerous. It's not going to help us as physicians to be able to treat our patients properly. I'm getting patients all the time using, for example, natural remedies and insisting that these remedies are going to be much better than taking their medications. They do not comply. They do not like the medicine for one reason or another. They feel it makes them tired. So we get these stories all the time. I think we need, as a medical community, we have to listen more to our patients. We have to explain more to our patients. We have to be aware of the burden of the disease on the patient, because the patient is a human being. I mean, I'm not just writing a prescription for a disease. I'm writing a prescription for a patient, and there is a big difference. So I think that this is so typical. Thank you for this video. But I think that the whole point of doing this chat today is trying to communicate very well with our patients and for a better outcome.
Thank you. Thank you so much, Professor Mahira, and for your really excellent answer and to the point. Now, turning to our patient, Nermine Zakaria. So from a patient perspective, what do you think are the real sources and reasons of those misconceptions and misinformation, and how does this impact the meaningful conversation between the healthcare community and the patients?
Hi, Reem. Thank you so much for having me. This is a very, very interesting place to be now, especially that I'm in the progress of establishing the psoriasis organization in Egypt. And this is an amazing opportunity. As a patient, primarily, the reasons for misconceptions are so many, okay? Psoriasis in specific, if I'm going to speak about that, because I've had psoriasis for the last 33 years, is considered a taboo illness or a taboo problem. So people do not really want to speak about it. They don't want to address the problem, and they don't want anyone to know. And this leads to them seeking information, treatment, as Dr. Mahira said and Dr. Hani showed in the video. They are looking for answers away from the doctors. They are looking for answers that are not going to cost them much, that are not considerably safe, although this is not true. And they are not really addressing the core of the problem. There is so limited time with the doctors, okay? And this also is a reason for the patient to suffer and look for the information elsewhere. The relationship between the patient and the healthcare provider is very strictly limited to the time at the clinic. Not all healthcare providers go the extra mile and give the patients the time and the energy and the appropriate advice. The patient is not there just for a prescription. They are there for help. They are seeking help. This is their point of seeking help. And this is, to them, the lowest, you know, when you are, I don't know how to say it, but you are desperate and you are looking for someone to help you navigate this journey. So it's not just the one step, one thing, and you're done. The tendency to consult family and friends runs, is quite a strong point as well, because they want comfort. So there is the lack of easy access to credible information on the internet. This led to that. There is no awareness about the disease because it's a taboo. So we need to break the taboo. We need to announce or inform the people what is the disease, what is psoriasis. It is not contagious. It is a non-communicable disease, as we spoke before. So information needs to be passed out to the people, the right information, how to seek help, where to find help, and what kind of help you can actually get. So this is my 2 cents on this for now.
Thanks, Nermine. Can't thank you enough. You've just provided a very clear picture of what the patient does go through following getting diagnosed. Thank you so much for that. Now, coming back to you, Professor Sabbour, and we wanted to ask you further on how does the misinformation on the internet, or let's say on the media in general, impact your patients, especially those with heart attacks, strokes, or cardiac death?
So I think everything that's been said until now is really fantastic. And I think the problem here is that when a person doesn't take medications that are known to reduce heart attack and stroke, we are deliberately ignoring the fact that they're going to have a heart attack and stroke. This is a fact. It is well known for the last 40 years that lowering the LDL by 1 millimole or 39 milligrams reduces heart attack and stroke by 20%. And it doesn't matter how you lower it. Anything that stops that, i.e. misinformation, non-compliance, non-prescription, actually increases this risk. And it's very unfortunate because in our region, we have a tremendously high incidence and prevalence of premature coronary and sudden death and stroke. It is actually the #1 cause of death in our region, all right? So when we come back to what's been said about misinformation, I think this is a critical point, right? Physicians have a very limited, unfortunately, because of how healthcare is structured now, amount of time with the patient, yet the patient has a lot of time with Google and the internet. Most of the sources on the internet are unvalidated. In fact, this has been looked at systematically in a rigorous analysis from the Journal of the American Medical Association. When people did a Google search looking for the word statin, 5 times more did they get statin harm, and 1 time more you got statin benefits. 3.5 million patients got the information that statins were harmful, and only 600,000 patients got statins are beneficial. It's 6-1. Imagine how that's going to impact your patient looking at Google all the time. Now, I admit that there is a problem in the healthcare system. One of my old professors, and I'm never going to forget this, he told us this in class. When the patient talks, don't interrupt. The patient is giving you the diagnosis. The patient is giving you the diagnosis. And in fact, this is a very key point. We have to listen to what the patient is saying, but more importantly, now we have to anticipate what the internet is telling them that is harmful. It is a public health hazard. When patients are getting wrong information, that seriously impacts their survival.
So, Professor Sabbour, having said that, what's your strategy to address this global media misinformation?
Right. So we have basically, as physicians, we have, as Professor Mahira said, we have sat with each other in our own conferences, we do our own papers, we don't transmit this information to where the patients are. That is the internet. This is a new life. This is the metaverse, as it were. So I think as medical societies and medical professionals, we all have to have a legitimate presence on the internet. Medical societies have to have more impact than just talking to their own doctors. We have to talk to patients. We must have patient groups like this one. This is an amazing opportunity to hear from a patient. What is their take on the story? Why do they have lack of trust in doctors? Why do we not have educators who specifically educate on disease activity? For example, in diabetes, the role of the diabetes educator for the last 30 years has shown a tremendous impact in survival in diabetes, because they teach patients about insulin, they teach patients about hypoglycemia, they talk to patients about side effects, they expand the role of the physician, and the role is diabetes educator. Why not a cholesterol educator? Why not a health educator, right? This is a real thing. It's actually a real thing. And as Ms. Nermine mentioned, patients need information. Diseases are difficult to deal with, right? It's hard enough being a patient. Empathy has to be shown, and education is part of that empathy. So we need to be on the internet. We need to have platforms that are attractive to patients, but also are legitimate and validated. We have to fight those people who lie and sell natural products. $30 billion are spent on useless natural products that have no impact and, in fact, divert patients from real therapies, right? We need to be there. And I think that's one of the roles of medical societies. The regulator also has to stop people who lie. If you lie about a lethal disease, you are having an impact on public health. You cannot be allowed to do that.
Thanks, Professor Hani, and thanks also for highlighting the role of diabetes educators, which could be a starting point for a number of diseases. So coming back to you, Professor Mahira, and being an HCP, from your perspectives, what other efforts could be made to improve health literacy and drive proper disease awareness for better health outcomes?
Thank you very much, Professor Hani. You've really nailed it. Now, the internet is the main problem we have. They listen to Mr. Google more, they listen to us. But not only the internet. We have a problem in the Middle East, in particular with the media outlets. All the time, doctors are on the media, unprofessional people on the media, talking about stuff and convincing the patients that this is the right way to go. And I think that this is very harmful to patients, because a lot of them are not educated enough to realize that some of this, what they're told, is not correct. And you find the patient coming in, I'm telling him, for example, you need so-and-so medicine for your disease. He said, no, but I read on the internet that this is not good. Like exactly how your patient told you, Dr. Hani, that statins are harmful. So we need awareness. We need national awareness. We need to be everywhere. We need, like Dr. Hani said, we need help with other staff and educators to talk to patients, to make them understand better about the disease. And then, to be honest, for example, a disease like psoriasis impacts people in all different ways. Maybe the impact, I'm going to give you an example actually with Nermine herself. Nermine is refusing certain medications. I have to respect that. And one of two things, I have to find a way either to convince her that she needs to take this if she really needs it, or I modify my treatment strategy according to her needs. Because the most important thing is her satisfaction, not mine. It doesn't matter if I'm happy. It really doesn't matter at all. I might write the exact correct prescription and she will go home and tear it up and she won't use it. The most important thing for me is she goes out from my office satisfied and at least believes in what I told her. I have to, like Professor Hani said, we have to help people to, their access should be better access to valid information. Now, the International Psoriasis Council, for example, is doing we were talking about doing some sort of patients' information together with IFPA, which is the International Federation for Psoriasis Association, that can be translated into different languages that will help people learn better about the disease. It's extremely important. Patients' organizations are key. We have to listen to them. We listen to each other more. We listen to doctors, listen to doctors. But doctors don't listen to patients often enough. So I think it's important. Now, IFPA, for example, they are present in every single meeting now that we do have. They have a voice and they tell us what to do and they tell us what their problems are. And I think this is extremely important. We have to increase awareness among the junior doctors as well, among the junior healthcare professionals, talk to them a lot. So I think this is it's a good start, but it needs a lot of hard work. And I think that your organization, the APPIS, is a start. At least there is collaboration between different aspects of the disease, healthcare professionals, the patients, the caregivers, the regulators. All these have to come together to come up with something that will really be useful for the patients.
Thanks, Professor Mahira. Now coming to Nermine, who's in the focus now as a patient, after having heard the solutions that Professor Mahira and Professor Hani came up with and listened to their thoughts. From all what they've said, what would be the most impactful, Nermine, from your point of view as a patient, and why? And then I'd like to hear 1 minute from you on how patient organizations can help in closing this gap.
Okay. I believe that the National Awareness Campaign is one of the strongest tools you can use to address any, not just psoriasis, any disease you need to address. You need to address how to handle the disease, what is the disease, because the patient is not a single person living on an island. He is associated with a family. There is a ripple effect that affects everyone around this patient. So the awareness campaign addresses everybody around this person, and hence it gives the information they need. You don't have these social problems from a man upset that his wife has psoriasis because he does not understand. He does not understand what the disease is, how to handle it, or any of the psychological issues associated with it, for example. I would also have to mention that the government regulating health related content, is very important. How the government deals with governments in general with health issues and with diseases such as psoriasis is very important to address. I see my timer is blinking already.
Please go ahead. Continue.
Okay. I'll move to the role of the patient advocacy groups that you've requested I speak about. I'm going to be very casual. I'm not a doctor, and I'm the least professional I could be about this. However, patient advocacy groups are meant to advocate exactly for the patients. In my opinion, and from what I've seen around me, I'm not trying to reinvent the wheel. The patient advocacy groups should act as a central hub, to receive and produce things that are related and helpful for the patients. So, for example, as Dr. Mahira and Dr. Hani said, the information that is sent out we need to have, for example, a website, an informative website that speaks in the language of the country, in English and in Arabic, for example, if we are speaking of Egypt, to explain exactly what is the disease, how it works, how it functions. People do not understand. If you have this information on the internet, which is the source that they are looking through or for, you will have information coming back at you that is the right information, how to deal with it, and away from the hocus pocus and I don't know, use this cream, it will treat you forever, and the things that we all know are not true and have no scientific evidence. The patient's advocacy also role is the hub part is, for example, for our psoriasis foundation that we are trying to establish, is we want to have face-to-face interactions with the patients. We want to have host psychiatrists, psychologists, to invite the patients and their families to come and address their questions, tell us what they want to know, what they need, what is it hurting them, how is it not helpful. Policymakers, okay, the health control, the healthcare, the HCPs. How can you help by collaborating with these entities to address the issue? So, for example, we want to, in Egypt, to include the psoriasis, the new psoriasis medications, such as the biologics, etc., within the health insurance. Okay, Dr. Mahira mentioned before that it was available because she spoke to me about it, but we want to make it more reachable. We want to make it more people be able to get it, because for some people, psoriasis is a hindering disease. They cannot function daily. They cannot have a normal life with the disease. So the collaboration between the pharmaceutical companies, because they have the information, they do the research, they have the backup that you as a patient advocacy group can take and go and help them or use them to approach the policymakers to shift things for the benefit of and for the sake of the patients. This is going to give us a huge impact, or have a huge impact on the psoriasis patients' lives in Egypt in general, or everywhere. I think this is, you understand my point.
Thank you very much, Nermine. And now, as we've,
thank you.
I think that the time is up for our fireside chat discussion. Now it's time to take some of the questions that have been posted by the audience. So maybe we can start with one question addressed to Nermine, and then another question addressed to you, Professor Mahira and Professor Hani. So starting with Nermine again, what would be the top piece of advice you would give to doctors to help improve their interactions with patients?
Listen to the patients. If I really, not because Dr. Mahira is here, but because if Dr. Mahira had not listened to me thoroughly and had empathy towards me as a patient, I would not have been with her for so long, and I would not be where I am now. Okay, I have doctor shopped for over 30 years, actually a little bit less. 25 years. I've been with Dr. Mahira for quite some time, but she respects my needs. She understands how I feel. She understands that I have a family that I need to cater to in a certain way. I do not wish to be using certain medications for maybe the wrong reasons in my head. She's taking her time to get through to me bit by bit in a way that is the right approach. So listening, being empathetic, understanding what the patient needs is for me the best thing to do.
Thank you very much, Nermine. I think it's an excellent answer, and in a nutshell, listen attentively to your patients. Yes. Thank you very much, Nermine. Now, there is a question coming from the audience addressed to both Professor Mahira and Professor Hani Sabbour. Having talked a lot about the role of professional and physician societies working together to create valid information and maybe even sharing it. But other than making the valid information available to the patient, maybe another thing to think of is how to make sure that the patients do understand how to access them, and if they are written in a language that can be easily understood in a lay language. So what's your comment on that point?
I think we have to have space on the internet that is directed to patients.
Yeah.
And one of the things that I will also share with you on the medical websites, for example, if you look at the American College of Cardiology, there is a patient space, but that's been around for 13 years. The number of unique visitors is less than 70,000. On the other hand, there are some famous people on the internet who speak in Arabic, who talk about don't take cholesterol medications, don't take diabetes medications, don't take this, don't take that. And these people have 350 million views and 10 million followers. So I think this is what the industry also has to help the medical society support: access to the internet. You know how Google and YouTube works. The algorithm is based on popularity, not scientific content, not truth, not correctness. So the more popular it becomes, the more hits it gets, right? So it's almost like a logarithmic curve. So I think this is what we need to do. We need to create and design medically validated content from medical societies and experts, and we have to push it. Don't expect people to passively come to you. You have to promote this actively, and between medical societies, regulators, government, and industry, this is the only way to capture the interest. And it has to be real stuff. Like, for example, what does a patient with heart disease care about? They care about not having another heart attack, not having an amputation, God forbid, not having a stroke. So we need to focus on that and speak in the
I think Professor Sabbour has frozen. So maybe let me address another question to you, Professor Mahira, and that would be our last question for today for our session. What efforts or successful experiences? So Professor Sabbour is back.
Yeah.
Sorry,
you were disconnected. Yeah, we lost you for half a minute.
Okay. So I was just saying that how do we generate evidence is not well known to the public. People don't know that we do randomized clinical studies, i.e. half the patients don't get medication. I had a very educated patient who is an engineer in nuclear physics. And he told me, how do I know what you're saying is true? I told him, well, half the patients get the medicine, half the patients get placebo. And he said, that's unbelievable. You mean you expose half the people to getting cardiovascular risk? I told him, yes, people have died for you to have this information. So really, we have to have that level of respect. I don't think people realize how rigorous it is to have evidence-based medicine. It's not just some of us sitting in a room and deciding we're going to do this and this is the right medication. So when people realize that this is the most rigorous kind of evidence, I think it's very convincing. But we have to explain this in a simplified way to the patients. This is very accurate information that has absolutely no bias. Companies cannot have any access to this medication when the FDA is reviewing it. So there's no commercial bias either. So all the stories are not true. But I don't think a single patient knows this.
We have to really also, for example, we have so many Facebook groups for psoriasis, for example. And the amount of stuff and misinformation written on this group is amazing. I just watch, I don't interfere, but I think it will help if we gain access to social media platforms, and this is favorite among patients, specifically not only on the internet as an internet, but a lot of social media platforms, Facebook, Twitter, Instagram, TikTok even. We were talking the other day that TikTok has become the most popular, and try our best to promote this information through all those platforms. I think it will help a lot, definitely.
Thank you, Professor Mahira. My last question before we start our next session. Where do you see the role of patient organizations in closing this gap and helping patients to access valid information and adhere to the healthcare professionals' recommendations for better disease management?
I think Nermine has explained this in an excellent manner, but I will add
from an HCP perspective. Yeah.
Yes, I will add an important thing. I would like, first of all, that meetings happen more often between the patients' organizations and the healthcare professionals, because this will raise the awareness among HCPs to hear the patient more, understand their burden more, and they have to understand that no one size fits all. It's not a matter of just a medication written in the textbook, and I believe that this will work for every single person. Dr. Hani knows that sometimes he will treat his hypercholesterol patients with statins, others won't respond. So I think that they have to understand that no one size fits all. We have to approach the patients and contact the patients with the regulators, with the policymakers. The government, we need to hear their voice. And I think I would like to thank you very much for everything.
Professor Mahira, Professor Hani, Sabbour, and Nermine, Zakaria, thank you very, very much for a very much needed conversation today. Thank you for all the insights and the inputs, and we're looking forward to building on it. And now let me introduce our next speaker for the next session, Dr. Stanley Lee, the founder and chairman of DXY, which is the leading digital healthcare technology company in China that covers over 70% of the Chinese doctors nationwide, and which was the first to provide a COVID-19 map in the world in January 2020 that was actually used as the working basis for Johns Hopkins Coronavirus Research Center. Over to you, Dr. Stanley Lee.